Okay. Welcome everyone to the sessions today. My name is Ponsak Siamonsak, the professor from Department of Pharmaceutical Technologies, Faculty of Pharmacy from Sirapakon University, and Vice President from Thai Industrial Pharmacists Association, Thailand. Today, we will have the sessions on the maintaining production QC in terms of COVID-19 restrictions. And we have the speaker with us to share his knowledge and his experiences on the production QC. Before we start, I would like to give a brief introductions about the speakers. First of all, I'd like to invite the first speakers, Mr. Richard Johnson, President of Parenteral Drug Association or PDAs from USA on the stage. Richard was named as President and CEO of the Parenteral Drug Association in September 2009. He has an active members of PDA serving on the Scientific Advisory Board, co-chair, the Regulatory Affairs Quality Control Committee, Sterile Aseptic Process Interest Groups, Aseptic Process Committees, GMP and Glass Defects Task Force as the chair. In his more than 30 years careers in the pharmaceutical and medical devices industries, Richard has been a recognized leader with excellent knowledge of US and international regulatory requirements, quality practice, and technical operations, especially in validation, sterilizations, aseptic, and sterile processing. Prior positions include the Vice President of the Global Quality Assurance for Food Drugs, Animal Health, a division of Wyeth, Directors of Corporate Quality Centers of Excellence for Abbott Laboratories, and both US and international assignment with Alcon Laboratory and Bausch & Lomb. Richard has Master of Science and Bachelor of Science degrees in Biological Science from Marshall University. He was also the co-chair of the U.S. subtask to ISO TC 198 on aseptic processing and has been the active in the PHRMA barcode committees, PQRI aseptic processing working groups, ISPE, and the Midwest Quality Discussion Group since the early 1990s. So I will give the stage to Mr. Richards, please.
Thank you very much. I am going to share my screen. Tell me if you can see it.
Yes.
Okay. So thank you very much for the opportunity to speak about PDA and our challenges and our objectives in Asia Pacific. As you heard, I've had more than 40 years of experience in the pharmaceutical and medical device industry, and I'm happy to join with you today. A few comments about PDA. PDA has been around for 75 years. This is our 75th anniversary. Our focus has been to create awareness and understanding of important issues facing the pharmaceutical and biopharmaceutical community and deliver high quality, relevant education and information to the industry. We are a not-for-profit organization. We operate globally around the world. I think everyone is very well aware that 2021 was another year of challenges for PDA and for the rest of the world. But in this period of global disruption, it's important for us to remember all those who have been impacted by the pandemic and the associated economic effects. And let's not forget to thank the first responders, the healthcare workers, and not the least to our own community, which is continuing to provide critical medicines and continuity of safe, effective supplies, and our hope for a future without COVID. So on behalf of PDA, let me thank all of you who are involved in this industry. As I mentioned, PDA is active around the world. We have several chapters in Asia and Australia, as you can see, Singapore, India, Taiwan, South Korea, and Japan. And we are very focused on expanding our offerings to people. We have members in almost every country in Southeast Asia. When I talk about PDA, I think the best way for you to understand PDA is to understand that we're about advocacy and outreach. So one of the ways we do that is by sharing knowledge. We do that through participating in and leading conferences around the world on very prestigious venues. We've had many meetings over the course of our history, and this year, despite the pandemic, we have had many different virtual conferences. We also offer very well-known training around the world, and that training is offered to people in industry and in regulators, and we have provided training to regulators around the world. Of course, we also prepare publications such as our technical reports, our research, our standards, and other technical documents that are very widely referenced and used by people in the industry and regulators around the world. We also share knowledge by having chapters and interest groups and other platforms for exchange. And I think that is a very key part of what we do. Another key area is driving for scientific consensus. Most of you who work in this industry know that the The basics everybody agrees with, but science continually evolves, regulations continually evolve, and it's constant need to bring experts together to try to interpret what is the current good manufacturing practice. That is why we develop technical reports, research studies, and standards to help guide people in industry and regulators on the best way to implement good manufacturing practices for pharmaceutical and biopharmaceutical, and to some extent even for other elements of the healthcare industry. We believe regulatory participation is very important, and we have regulatory participation in one form or another in every technical document that we produce. And of course, we also collaborate with other organizations. I've listed a few, but obviously we are participating today with CPHI Southeast Asia as part of our effort to try to inform and develop scientific consensus in the industry. Again, a very key part for us is engagement with regulators. We have been doing joint conferences with regulators for many years. This past year, we celebrated our 30th annual PDA FDA Joint Regulatory Conference. We've done it with EMA and with many other regulators around the world, including PICS and ICH, and we continue to do that. We also review and comment on pending regulatory documents, and I can tell you through our interactions with regulators, they respect our comments, and I think that they value the input that we provide through our members to the regulators. And let's not forget, we have almost 1,000 regulators around the world who are members of PDA. They are participants, they are reviewers of technical documents, so they are not a separate group, they are part of PDA, and that is very valuable for us. This past year, despite the pandemic, we did have 2 virtual conferences. One in October, both were in October, but one in aseptic processing and biopharmaceuticals, and then one on a regulation in Asia Pacific that was based in Singapore. But we had participation from throughout the region and in fact around the world. As I look ahead to next year, of course, we are developing our plans and finalizing our budgets. So you can see here quite a few events that we are planning in around the world, in Europe, in the United States, and in Asia Pacific. So I will make the slide deck available to everyone, and you can certainly go to our website to find out more details. But I will especially draw attention to the fact that we are planning to do 2 meetings at this point. We're hoping that they are going to be in person, one in Singapore in September and one in South Korea on aseptic processing of biopharmaceuticals. So I hope you will consider and join with either those meetings or any of the other meetings that we have around the world. We've also been focused on expanding PDA training, and we have been doing this for a number of years now. And so next year we are planning 12 courses in India that will be in person. We are also planning 3 courses to be in Asia Pacific area in person, and many more courses, at least 13, will be offered at time zones that are convenient in Asia, which will be online, but we will have live presenters and live Q&A. It's been a very active period for PDA in terms of our technical activities. And here you can see that despite the pandemic, our volunteers have been very active, and we have added substantially to our body of knowledge that we have prepared In 2021, you can see a number of technical reports, points to consider papers, research surveys and laboratory research, and 2 standards that have been published this year. Next year looks to be equally full, and so we expect that we will continue to maintain a very high level of output. And as you can see, it's a very broad spectrum of topics. So I will point out, for example, that we have put out points to consider for remote inspections, which of course, because of the pandemic, interfering with the ability of regulators to travel to sites to do inspections, that they have been exploring. We will add to that next year with our points to consider for remote audits, because of course companies have to audit their suppliers and their vendors as well. We are also expecting to publish points to consider for lessons learned from the pandemic, as well as a number of other topics from data integrity to cryopreservation of especially of cells for cell and gene therapy, and quality risk management of aseptic processing, package integrity testing. So we cover a wide variety of topics. I should mention that almost all of these documents are available to members as part of their membership, and they are available for sale to non-members. So you can certainly go to a PDA website, and you can, if you're a member, you can access them through the portal, or if you're not a member, you can go to our bookstore and see how you can acquire them. I would be remiss if I didn't encourage you to consider becoming a member of PDA. And this is just a snapshot from our website at www.pda.org. But you can see it's very easy to renew or join PDA. You can become a member. You can fill out an application. You can get information that may help you justify your membership for your management. But also there's a place to volunteer for different things, and I'll talk a little bit more about other volunteer opportunities. So, you know, I was a member of PDA for many years before I became president. And so I can tell you from firsthand experience, there are many ways to become involved. You know, we are constantly looking for people to write articles for the PDA letter or scientific articles for our journal. You can post things to our PDA Connect site if you're a member. We are also looking for technical report peer reviewers. So if you have expertise in a certain area, we would certainly encourage that. You can become a speaker at one of our meetings or at one of our chapter events. If you have expertise, we would be interested in talking to you about you becoming an instructor for our education. And at many of our conferences around the world, we offer the opportunity to make a poster presentation. Of course, if you want to be more involved, there are opportunities such as being a task force member or various things associated with PDA activities, including volunteering to be a member of a program planning committee. And you know, those meetings that we do around the world, everyone has a set of volunteers who function as the program planning committee and help us decide what are the topics and what are the speakers that we should be looking for. As you advance in your leadership at PDA, there are standing committees that you can volunteer to participate in, going up even to advisory boards, and we do have a number of advisory boards. We have interest group leaders and chapter officers and committee or AB leaders, and eventually, of course, board of directors and executive committee. So there are many, many ways to get it started. And I would encourage anybody that wants to get involved. If you are a member, please don't hesitate to reach out to us. at this website or through any of the other email addresses that I'm going to give you. And we would be more than happy. Every year we have more than 2,500 people like you who volunteer to carry out PDA activities. So again, I want to emphasize, you can, no matter where you are in your career, you could become active in a local PDA chapter, or if there's not a chapter in your country, you could talk to us about how we might start a chapter. You can speak at one of those meetings or in various other ways, as I've already talked about. You can be on a task force. We have members from all around the world who participate in our task forces. So every technical document that we produce has a task force made up of volunteers, supported by staff, and at any given time, we have more than 50. So there are a wide variety of opportunities available. So feel free to reach out to your local PDA chapter if there is one in your country, or reach out to the APAC offices, or contact volunteer@pda.org, or feel free to send me a message. Apparently everybody in the world has my email address. So I would encourage you to think about that. And finally, I think the global pandemic has demonstrated the strengths of our industry, but also the weaknesses in our global supply chain. We are all focused on how we move forward, and that can only be through a collaboration between governments, biopharma industry, healthcare providers, and the larger community of nonprofits, suppliers, and others. And that's where PDA fits in. Obviously, we're all focused on resolving this pandemic and getting beyond COVID, but we also need to think about what we've learned, because it is very unlikely that that will be the last pandemic that the world sees. And let's not forget that there are millions of people around the world who have been impacted directly or indirectly, and who are depending on our industry to help them get out of this. So thank you very much. I have a slide here that shows you our team in Asia Pacific. They're based in Singapore. They've got their names and their email addresses here. Feel free to reach out to them. And I believe Marcel may be participating in this call. And here is again another set of contact information. So with that, I am going to end my presentation, and I will be glad to try to take any questions. So.
Okay, thank you, Richard, for the interesting informations of the PDA. And now we know the role of PDA to the pharmaceutical and biopharmaceutical communities. And probably the audience could join the PDAs by applying as a memberships, or can join, become the active local PDA chapters in your countries, or write the articles to the PDA letters or PDA journals of pharmaceutical science technologies. Also, Richard mentions that the everyone can help the communities by giving the talks at the chapters, meetings, or global conference of the PDA, or volunteer to help like translations, PDA technical report, or help to peer reviews the draft of the technical papers, etc.
Yes, that's a good. I'm glad you brought that up, because we have been working on providing more technical documents in multiple languages, but we depend on volunteers who have expertise in their language as well as English to help us with that. So yes, that's a great opportunity for some people if they have that capability and that interest. So.
Yeah, okay, that would be the good opportunities for the audience in the countries that would like to translate into your languages. Okay, Um, Due to the unexpected circumstance, Dr. Tony could not join us for the talks today, but Lichas will respond all questions regarding the topics today or other related issues. So if the audience have any questions on the PDAs, on the production QC in the COVID-19 restrictions, you can give the questions to the chat and our team will pass the questions to me.
Yes, if I may, I'll just say a few introductory words. So I'm very sorry that Dr. Tony Kandel is not able to join us. He had fully intended to, so I'm afraid that something has happened that has prevented him. Unfortunately, I do not have his presentation, but I can tell you early on in the pandemic, PDA formed a COVID task force. If I could figure out how to do it, I would show you on our PDA website. I'm going to try to do that right now. There is on our homepage a special place for this, and I'm trying to get there on a different browser so I can share that. So just bear with me a moment. Okay. So, okay, so I'm going to share this if it's okay, and then I can explain a little bit if that's all right. Is that okay?
Yes.
Okay, so you can see this is the PDA website. Can you see that? Are you seeing my screen?
Not yet.
Oh, there we go.
Okay, it's coming. Okay.
Okay, so this is the PDA homepage, www.pda.org. And you can see that there's a lot of information here on various things, but right on the front page is a special section where we have PDA COVID-19 updates, podcasts, surveys. And so if you wanted to find more information there, you can see that there's information that you can access. There are some videos that you could look at. And specifically, we prepared a paper about protecting the manufacturing employees in a GMP manufacturing facility from coronavirus. So this was prepared, last year, but you can access these. They are available to members and non-members alike. So that may be useful to you. But if I can get back to that page, there's also some information about the pandemic task force. So PDA formed this task force shortly after. There's a video on that page. It talks about some of the things we're doing. There are some documents that you can access. There are, information about various webinars that we have done, and I believe there may be some things on our YouTube pages, our YouTube channel as well. So I hope that's not as good as having Tony Kandel's presentation, but PDA has been very active since the beginning of the pandemic and in responding to that and making this information available to our members and non-members alike. So, that's part of our effort. So with that, okay. I would be glad to take any questions and do my best.
Okay, thank you. So the audience can go to the website and you can get the informations and also the material like the slides, and you can see the videos on the related topics. And yeah, I think that would be useful information. Okay,
Yes.
now we have few questions from the
Okay.
audience. So they ask, should pharmaceutical companies require mandatory COVID-19 vaccinations and screen employees when they arrive for work?
Well, that's a very difficult question to answer because, you know, there are people from many different countries in the audience, and many countries have different sets of rules. But what I can tell you from what we have talked to our members and their companies, many pharmaceutical companies around the world are in fact requiring vaccines or a testing regimen for people who either cannot receive the vaccine or who have some medical exemption or something like that. But I think that that is variable depending on the region that you're in. But I can tell you that we are constantly talking to people in our community, and most companies that I've talked to are requiring their employees to be tested, vaccinated, including fully vaccinated, meaning depending on the vaccine, 1 or 2 shots. And now boosters are starting to become available in some countries. Or as an alternative, some testing regimen. And people who refuse, in some cases, are being released from the companies. But I think that's a country by country legal issue. So I can't give you a blanket answer there. So if you want my recommendation, I think that I certainly am a strong advocate for people getting vaccinated whenever they can. But in some countries around the world, it's still not as accessible as it is in other countries.
Yes, thank you for the answers. So the next questions, are vaccines against the SARS-CoV variants difficult to develop? And their clinical trial must be repeated to demonstrate safety and effectiveness.
Well, I think I and many other people were very surprised at how quickly vaccines were developed for COVID. Prior to COVID, the shortest vaccine that I was aware of, at least in Europe or the United States, the fastest was 4.5 years. And obviously we had vaccines that were being developed and authorized for emergency use within less than a year. Some of that was because of new technology, especially the recombinant mRNA type of viruses that allowed much more rapid. But to my knowledge, in every country around the world, all of those were subjected to evaluation for both efficacy and safety. And, I can only say that even though there was certainly a lot of priority put on it and a lot of rapidity at making things available for emergency use, that does not mean that there was not a lot of evaluation of the safety and the efficacy of those vaccines. So I believe that it was very impressive how rapidly that vaccines were able to be developed through a number of different ways. And of course, there are some that are still in development through different types of things. And of course, as every new variant comes out, people are, they are evaluating the efficacy of those against the variants. As far as I know, at least up through Delta, all of the major vaccines around the world that I'm aware of were also effective against the Delta variant. And I am sure that right now the Omicron variant is being evaluated. But all I can tell you is all the information that I have, and I am monitoring this daily, is that your best advice is to get one of the, the well evaluated vaccines, the Pfizer BioNTech, the Moderna vaccine, the AstraZeneca vaccine. I know there are other vaccines from Russia and from China. I'm not as familiar with the safety and efficacy on those. Johnson & Johnson vaccine. So I personally have had the Pfizer BioNTech vaccine, including the booster, so 3 doses total. I had no adverse reaction. My wife got the Johnson & Johnson vaccine and the Moderna. So I can tell you all employees at PDA in the United States are fully vaccinated. So, but I also can tell you that many other companies I talk to have implemented some kind of mandate on that. So I think they have been studied quite extensively and with a lot of extra effort on the part of regulators and researchers. And I am quite confident that they are safe and effective.
Okay, thank you. So if the audience have any questions, you can put in the Q&A box, and then we can pass to the speakers. So if not, we have the last question here. Has the increased usage of chlorine disinfectants and alcohol hand sanitizers contributed to increased antibiotic resistant bacteria? So do you have any?
Yeah, I think number one, disinfectants and antiseptics are not the same as antibiotics. So they do not contribute to antibiotic resistance. That's a different mechanism than an antibiotic. And so I don't think that is a concern. I think that, correct application of disinfectants and sanitizing agents and things like that are a very important control measure for surface decontamination in general, but also specifically for this virus. And I can tell you that early on in the pandemic, there was a lot of focus on hand disinfection and hand washing, and that's always important for any microbiological control. But the SARS-CoV-2 virus is not especially resistant to antimicrobial disinfectants or alcohol or so on. So they are quite effective. But the fact is that most of the evidence points to transmission is mostly aerosol. So wearing a mask is a much more effective control measure for preventing aerosol dissemination of this virus than surface disinfection. But surface disinfection is also, including of your hands, is a good control measure to use anyway. And in most pharmaceutical facilities, we're already doing that as part of our microbial control for our manufacturing sites. And those methodologies are quite effective. But I can tell you, we are using sanitizers for offices and desks and common areas in our facilities, and most venues that I've been in are doing the same. That does not contribute to antimicrobial resistance. That's a different mechanism. Okay. I hope that answers the question.
Okay, thank you. And that's all for the questions from the audience. And I think no more questions. So I would like to thank the speakers, Richard. It was a great experience having you at this event, and we sincerely appreciate you for taking out your times from your busy schedules to provide us with such valuable information. It would be our pleasure to invite you once more to share the experience around the subjects in the futures. And thank you once again.
Well, thank you very
thank-
much. And I will also follow up with Tony Condell, and I will see if we can make his presentation available to you so that people can look at it, you know, after this event. Okay.
Okay. Yeah. Okay. Thank you. And that would be the conclusions of the sessions today. Thanks also for our audience for attention, and I look forward to our next interaction soon. Have a great day. Thank you and goodbye.